my roommate, Vanessa. This is my dog, Cupid. This is our turtle, Speckles. But, yeah. So, it's been, I don't know, almost 2 months since I got my braces off. My surgery was May 24th, I'm pretty sure. I'm doing great. I'm very happy with the results still. No pains still, no problems. My teeth haven't moved. Well, I haven't been wearing my retainer as often as I should, so one tooth has started to rotate a little tiny bit, but if I put my retainer in, it corrects it and it's all good. But I can't stress enough, if you want to keep your results, wear your retainer. Like seriously, even if you feel like you look stupid, it's a lot better than having to get braces again. Like, wear the retainer, it's not bad. And, okay, so, I don't know where to start. I wanted to answer a ton of questions and do, like a food menu, what to eat during the surgery, and this is just an everything video. So if you want to know questions or answers to questions, just watch the rest of this video. Okay, so to start off with, I had an underbite since I was, you know, I don't know, whenever my underbite started to develop. I don't think I had it when I was born, but I don't know, whenever your jaw starts to develop and, you know, you're growing and all that stuff. So I had an underbite and it was pretty bad. It was, I could stick my tongue like through the underbite, through my teeth pretty much. And they decided when I was about 15 that they were going to do jaw surgery. And I had braces put on when I was maybe 14, and then I got them off when I might have had them put on when I was 13, and then I got them off right before I turned 15, or around that time. I don't know, 13, 15-ish is when I had braces the first time. And then they measured my height every year to see when I would stop growing, because if you get the surgery and then you continue to grow taller or anything, it's very possible that bone will continue to grow in your jaw and it'll mess up all your results, and you could even get an underbite again or a crossbite or just, I don't know, anything, something bad. And then, so about a year ago, about a year and a half ago, they decided I had stopped growing taller, and my orthodontist recommended me to an oral surgeon who was great, Dr. Mark B. Jacobs in Highland Park, Illinois. He's a really great surgeon, excellent. I recommend him 100%. And so I went to see him in May of 2009, and he took pictures, he took x-rays, and we were going to do the surgery in August of 2009, but my insurance didn't go through yet. Like, they hadn't approved me yet. So we had to wait, and then we were going to do it in December of 2009, and then that didn't work out either because we were still waiting on insurance and school. It didn't seem like the right time and everything. So then the insurance finally approved. I was so happy. We called them like all the time before they approved me to try and, you know, make sure it went through. I did have to send them some documentation of when I was in elementary school. I had speech therapy, and they had said that it could be I couldn't pronounce certain letters or words, and they said it could be due to the underbite, and they had written that down, you know, so like a while ago. And so we sent them those papers, and then I finally got approved, and then we decided to do the surgery in sometime between like March and May, but I had to get my wisdom teeth out, and you have to wait 8 weeks after you have your wisdom teeth removed before you can have any type of other surgery on your jawbone, because when they remove your wisdom teeth, you're like right here where they pull them out from the bottom jaw, it's like your bone is extremely thin afterwards, and you have to wait for it to like regain strength and everything. So I ended up waiting till I was done with school. I got my surgery 3 days after I finished school. It was great, and it was May 24th. I'm pretty sure it was May 24th. And I went into a hospital you can watch my first video to get this information, but I went into the hospital at 5:30 in the morning. I think it was 5:30. And they prepped me for surgery, gave me drew blood, gave me an IV, and then, what else? And then I waited for maybe like 30 minutes, I don't know, and then they brought me into like the preparing for surgery room, and they put something else in my IV. Oh, there's a cop. What's it called? When they put you under, whatever, they gave me that medicine, and it put me under, and I honestly don't even remember, like, them changing the IV pack and all that stuff. Like, I don't remember it. I know it happened and I was awake, but I think when they put you under, you forget a little bit before, as well as the entire during, obviously I don't remember anything from the actual surgery. I was obviously asleep. So, I woke up, and I was so happy, and I actually have the piece of paper when I was still in the recovery room, not even put into my, like, ICU room yet. They gave me a piece of paper to write on, and I was scribbling. I have it in my room, but I'm not going to go get it, because this video is long, and I wrote, like, I'm so happy, thank you, am I pretty, like, all these silly things. I mean, I'm missing letters, you can't even understand it, but that's pretty much what I'm pretty sure that's what I meant to say and write out. So then I woke up, or then I really woke up, and I was in my ICU hospital room. That's the intensive care unit, and I was still really happy. Like, I wasn't mad. Like, sometimes you get side effects from being put under. Like, you can be really groggy, you can be cranky, you can be like aggressive, you can, I don't know, lots of things. It affects everyone differently, and sometimes it's hard to wake up from it, but I mean, as far as I know, everything went very smoothly, and I was so happy, and I couldn't smile, but I was just like I was just ecstatic. Like, my emotions were on a total high. Like, I was so happy. And I stayed in the ICU for 3 days, I think, and then on that third day I was moved to a normal hospital bedroom, and then I got to go home that night, I think, or that day. I don't know, because I was woken up, I was on morphine every 4 hours, I think, and I was also on antibiotics or something. I don't remember what medicines I was on, but so they had to wake me up every few hours to give me that, and make sure that my blood pressure was okay, and my temperature and everything was fine, so there's no infection and no, anything like that. But I did fine. The hospital room was great, the staff was great. I mean, I wasn't in pain. I mean, the morphine stung a little bit. I had the IV in my hand, and it stung a little bit when they put it in, but honestly didn't hurt at all. The most painful thing of the entire event from May 24th to now was getting the IV put in. So if you've ever had an IV and you know that it doesn't hurt, because it really doesn't, then you're going to be fine for the surgery. I mean, I might have just had really lucky results, because I honestly was not in pain. I 100% don't remember any pain besides when they put the IV in. Like, that, it pinched, but that was it. So, there's a fuzzball thing. Okay, oh, and while I was in the hospital, they wanted me, obviously, to stay hydrated, and they wanted me to drink, you can see this in my other videos, but they just wanted me to stay hydrated and drink a lot of fluids. They brought me apple juice and, any type of juice I wanted that wouldn't sting my incisions. And about the second day, I discovered